And you're live. Frank?
Hey, everybody, this is Brian. How are you?
Hey, Brian, it's Pat.
Good, how are you?
Good, good.
I don't know if Frank is on yet.
He was calling up in a second. Did you get off the phone with him?
Hi, this is Frank McMillan.
Hey, Frank.
Hi, Joe.
How are you doing today?
I'm good, thanks.
Hey, Frank, it's Pat.
Hi, Pat.
Caroline's here too. Hi, Frank.
Caroline, awesome.
Brian's here.
I got
Steve.
Brian. Yep.
Steve, Caroline, Frank, Pat.
Yep. Michelle.
Okay.
Hi, Michelle.
Daphne's here as well. Hi, Michelle.
Hello.
Okay, I'm just getting down everybody who's here. Steve, Joe, Patrick. Okay, so I got Patrick, Joe, Michelle, Daphne, myself. As board members, I have also Brian and Steve, and who else?
Caroline.
Caroline.
Oh,
okay.
Carol. Yep. I'm on the line too.
Who's on the line too?
Tony.
Tony.
Oh, Tony. Okay. Okay, so it is 7:02 and all members are present. I'm going to open the meeting. So welcome to anybody who's listening. My name is Dr. Frank McMillan, Jr. We are opening the Board of Health meeting, and as I call off your name, just please say that you're present. I have Joe McCarthy. Joe McCarthy present? Joe McCarthy. I thought he was present. Maybe I'm wrong. Michelle Davis?
Here.
Okay, Patrick Scanlon?
Present.
Caroline Ibbotson?
Present.
All right, and Daphne LaFleur Alva? Or is it Alva
I'm here.
LaFleur?
Alva LaFleur.
Alva LaFleur, my apologies.
Okay.
And Joe McCarthy is absent, am I right?
He might be jumping on late because he was on earlier with me. So he might be jumping on a little bit late.
Okay, so there being a quorum, I'll call the meeting to order. So we are now in open session. First item of business is the Pledge of Allegiance. We're going to dispense with that since we're not in front of a flag and not with each other. But we will move on to the next item of discussion, which is COVID-19. I'm going to let Brian just kind of introduce what is going on and kind of highlight some of the opportunities that we have to be helpful.
Okay, thanks, Frank. As of today, we have 328 confirmed cases in Massachusetts of COVID-19. We have two positives in North Andover. Our second positive was just alerted to us the other day. We are monitoring quarantines and the installations. We are participating in state and local conference calls on a regular basis. We are meeting regularly with town officials and giving guidance. Guidance on protecting residents, town staff, like inspectors and fire department, police department, things like that, emergency management and operations. We're issuing guidance on the closures and public service announcements, getting information to the residents. We did complete training at the fit testing of N95 masks at the fire department for all fire department shifts. Caroline and I are answering the COVID hotline questions in emails as well as the town manager. So anything that comes in on the hotline comes to our inboxes. and we are doing that 24/7 at this point. Basically answering all the resident and business questions and complaints. We've posted restaurant guidance at all the restaurants in town, and Steve's gone out and met individually with the restaurants that had questions. We've been working with and talking to long-term care facilities and having outreach with them. In discussions with different daycare facilities. The governor did just declare all daycare centers will be closed as of this coming Monday. So tomorrow is the last day of business that daycare centers will be open unless they get written permission from the EEC to stay open and take care of essential personnel, children. We working with the schools
Brian,
and the seniors.
Hey,
Yep.
Brian, it's Pat. Just a quick question about the daycares. Have any North Andover daycares applied for permission?
Not that I know of. I know that KinderCare was one of the last ones remaining open. They did
Okay.
have a potential exposure the other day, so that
Uh-huh.
kind of freaked them out a little bit. But I'm assuming one will probably apply. I'm assuming it will be KinderCare. They're probably the biggest organization
Okay.
that we have in town for a corporate daycare center. But I have not heard
Okay.
any word as to anybody actually doing it yet.
Okay, thanks.
Sure.
Brian,
Working with the schools. Yep. Go ahead, Brian.
Brian, can you hear me?
Yes. Hey there, Joe. Welcome.
Yeah, well,
Welcome, Joe.
I've been on before 7 o'clock. It's just that I don't know why I wasn't able to get through, but nevertheless, I did hear you. Daycares, Brian, closed tomorrow. Does that also go for religious facilities that have daycares?
Yes. If they're registered with the state, and most all child care centers have to be, they have to get licensed, then they will be closed unless they apply for and then get in writing permission to stay open for emergency personnel, children of emergency personnel, or essential employees. We are working with the schools and the senior center in the town on food and meal distribution through the Meals on Wheels program and the school breakfast and lunch programs that actually started today. I think they did over 350 meals today, and they did expand the Meals on Wheels outreach for people that aren't eligible or weren't eligible prior to this situation. We're working with Deanna Lima on behavioral health outreach and issues as well. We're also going to be looking for a grant through the Massachusetts Area Planning Council, the MAPC, which is our regional agent for our local coalitions. And they have money lined up for local public health. So going to try to get some money to do some things with that. The town manager did actually declare a state of emergency at the selectmen's meeting last night, which gives her additional powers. The town hall is now closed until April 6th. So we're on a skeleton crew over here with, obviously all of us are working, but the town hall is closed and they have 3 people manning the COVID hotline and the town hall phones. So all numbers come into the 3 phones and are directed and sent to whatever department they're looking for, or if they have questions, they are sent to Caroline or myself. And we are working with them. They may cut that down to 2 staff starting next week. We've done some PSAs for social distancing and some outreach with that. Steve and I drafted up a PSA for how to shop safely and protect yourself out in the retail environment. And we're looking to get more information out there as things pop up and just trying to keep ahead of everything. I think Caroline has some updates as well on her end, if she wants to chime in.
Hi. So I've just been doing a lot of the follow-ups with residents. So anyone who has had any travel within the last 14 days and is showing symptoms or maybe just had some exposure. So I'm basically following people who are on quarantine or people who are on isolation, trying to keep up with all the testing and guidance regarding what is required to be tested, and just trying to be an essential resource for the residents who are going through this right now. Trying to just kind of get the urgent cares and reaching out to Lawrence General, make sure Lawrence General is doing a great job. They have a hotline. They have a tent set outside. Holy Family just started testing. Lawrence General's been doing it for a while. So, so Holy Family, you can go and get tested if you have a doctor's order. Lawrence General, they have a hotline. You call ahead of time and you say what your symptoms are and what your exposure possibly was, and they'll say, okay, yeah, you can come, or no, you don't really meet the criteria. Now, urgent cares are also testing as well as primary care, so it kind of widens what we're seeing in terms of people who maybe aren't really meeting the criteria but are being tested. And I think as we kind of move through this, that's what we're going to be seeing on a bigger front anyhow, is just we have the capacity to test, so we should be, testing as we see more kind of coming at us. So,
Caroline, one question before you move on.
Sure.
When you described the testing at the two local hospitals in Methuen and Lawrence and probably Haverhill, it's by appointment only. You can't. It's not just show up and be tested. You need to have an appointment or a doctor's order, right?
So Holy Family is, yes, by a doctor's order. I don't know if it's by appointment, but I know they do need a doctor's order. With Lawrence General, the way I have worked with them is that I have actually called over there, talked to the nursing supervisor, told her what was going on, and she said, okay, this was before they had the tent set up, so this was when they were just going through the emergency room. She said, have them come, ring the doorbell, we'll come out, So they had a system down before they set up their tent. So I believe it's still, walk in, but give us a heads up that you're coming. I don't believe it's by appointment at Lawrence General, but Holy Family, I'm not sure.
So what would your advice be to somebody in the public who thinks they may have been exposed? Should they call you, or should they call the hospital directly, or should they call their primary care doctor?
So they can do any of those things. I think some of the primary cares, I've had a couple of primary cares call me and ask me, I'm sure they're inundated with patients right now, and they may not, and the guidance is changing so quickly that I don't know if all of them are up to date on it. So some of them have called and said, what do I do? I have this patient who thinks they've been exposed. And so I have my line open. So if they call during the day, to the hotline, it will come to me. And then after hours, I'm providing my cell phone number so they can call me. I just don't want them to have to be sitting there waiting and trying to figure it out. Lawrence General's hotline is also a great resource as well. So any of those would work.
And they would find that number on the Lawrence General website, or where would they find that number?
So that number is on the Lawrence General website, yes. And then we can try to put it out on our website as well. And then they can also call the Massachusetts Department of Public Health and get information there as well.
All right. I interrupted you. Please continue.
Oh, no, so the other thing that we were trying to do was trying to get to our vulnerable population. So our seniors, we know our seniors who are in senior housing, but we don't know the seniors who are out there living on their own and maybe don't have any support, maybe don't use the internet, they're not on email. And how do you get the information out to them? So we got that flyer together. We had emailed it to you earlier, the North Andover COVID response that has how they can conduct town business now that town hall is closed, and what other services are offered as far as the food goes, and if people want to volunteer. And then on the other side, we have the COVID hotline. We have the web page, the email, if they want to email us in questions, and then just those basic recommendations that have not changed, preventative practices that they can continue to do, social distancing, staying home if you're sick, washing your hands, that kind of thing. So we're going to get that out by a town-wide mailing, but we're also going to get this out to senior housing in the next couple of days because we want them to have that information sooner than later.
Great.
Okay.
This is Joe. Just a point of information. I have not read about appointments being required at Holy Family, but I have read just that that a doctor's order is required. I believe it's just drive up. You have a doctor's order, you drive up, they will sample, and you'll get the results back. And I think it's a matter of a relatively short period of time, less than a day, but I'm not sure on that. Problem is that there's a lot of information out there right now, and it changes on almost an instantaneous basis. So it's really hard to keep apprised of what's going on. Another question concerning, and again, I just got an email at 6:45 on further closings in North Andover, like saloons, barber shops, massage services, body, tattoo services, et cetera, et cetera. Does that also include physical therapy? If you have an appointment with a physical therapist, is that out now, or is that still open?
That's a great question. I think I'm gonna ask Brian to speak to, you know, the professional services in town. Brian, what would you say about that?
I think as of right now, physical therapy, I think, is still allowed. I know that it's very close contact, and that may change, and that's maybe something you guys want to think about. The other things like nail salons, hair salons, massage parlors, a lot of them are closing on their own. We've had a lot of inquiries as to what they should do from salon owners, trying to protect their employees as well as their clients. And I think that's something we want to talk about tonight and make a decision on what to do with them. I was going to bring that up under new business and see what you guys want to do. But I think the under 25 person rule does come into play in certain situations like medical and physical therapy. I think the gyms in areas like that, the fitness centers, most of them are closing. I think it's hard to keep the limit to 25 and under. Some of them have tried to play off 25 people per room, but we've kind of put a stop to that already. So it's kind of in flux right now. I know certain gyms have closed, some are still open at this point, but we can get into that in a little bit. I'm going to ask Steve to give his update next, if you guys want to let him talk for a minute.
Sure. Steve, let's hear it.
All right, hey guys. So a lot of what I've been doing originally was with the food establishments. So one of the first things was sending out basically an email to all the food establishments early this week. That just included a posting for their door that covered the Governor Baker's order regarding no on-site consumption of food or drink, and that they had to do takeout or delivery only. And then it also touched upon if you're retail food, where obviously you're not doing on-site consumption of food or drink, that you have to make sure you keep it to under 25 people pertaining to the limit on the gatherings. It also included in this email a handout from ServSafe, which touched upon things like employee health, like if you're sick, stay home, don't come to work, and hand washing for the most part, and then a copy of Governor Baker's order. This week, I've been also going out to the establishments just to make sure they had these postings up. A lot of them were pretty appreciative of the posting just because they do have some people who come in and either haven't heard or just from being in a routine like to, you know what I mean, like grab a cup of coffee and sit down and be able to hang out in the establishment, giving them something to be able to say, hey, like, look, it's right here in writing, you can't do this. They were very appreciative of that. And just to talk to them too, just to make sure that they were adhering to that and see if they had any questions. I did want to say thank you to Bridget from SweetSafe because she did come out and help us out one day with the postings when we were very busy. And then I've also been trying to reach out to gyms and fitness centers too, just to see if they're open, and if they are, how they're pertaining to or abiding by the 25 or under limit. I know, for example, one establishment in town, I believe what they were doing initially it was 25. I think they cut it down to 10, and they were actually, and this includes staff obviously. So the one person who was working there had, I think it was like 9 placards that they would give out, and once they got to 9, they wouldn't let anyone else in until they got one back. And obviously when they got that placard back, they would sanitize it. And I also talked to them about, you know what I mean, making sure that they're keeping up on wiping down equipment and sanitizing certain areas of the establishment. And then I did want to just add that from going around too, I did notice that some establishments have either altered their hours, which was kind of expected, or closed temporarily just due to the takeout or delivery only requirement. But there also were some other establishments that can close on their own, as Brian touched upon, such as there were a couple, I think, salons and barbershops in town that had just shut their doors just to focus on their employees' health and keep them safe. And then also, as Brian said, we've just trying to really trying to get educational material out to the public just to keep them as well informed as possible. Someone mentioned earlier, a lot of this stuff is like pretty constantly changing, so we're trying to keep up with that the best we can. But we've drafted a good amount of documents, I think, to get out. Some have been on social distancing. We came up with one, I think, today. It was on keeping yourself safe while you're shopping and stuff, because obviously that can be an area where it gets very busy. And at how the COVID-19 virus spreads, crowded areas can kind of be a problem. So we just want to give people some tips just to keep them informed and hopefully keep everyone as safe as possible.
Very good.
All right, thanks, Steve. Get a little tidbit of information here, Frank.
Yep.
Thank you, Sarah, for sending this to me. It's hot off the press. It's about Lawrence General. About 2 hours ago, they announced that they are offering community COVID-19 testing at a drive-through screening tent on Prospect Street in Lawrence. If you believe you need testing, we require that you have a physician order and schedule an appointment. Please call the Lawrence General Community Screening Line at 978-946-8409 to schedule an appointment. Operating hours of the drive-through are Friday, March 20th, 12 to 4. Saturday the 21st from 12 to 4. Sunday closed. Hours for the coming weeks will be announced soon. So they have their testing set up, their drive-through tent, and they just made an announcement. So thanks for that information, Sarah.
Very good. I'd like to open it up to the members. We're going to have to just do this one person at a time, so I'm just going to call on you individually just so that we don't have chaos. But why don't we give everybody just a chance to say what they wanted to say, and then what we'll do is we'll go back and just take notes, and then we'll go back and ask questions of each other. And I apologize if anybody feels put on the spot. If you want to pass, just say pass. So I think I'm going to start with Patrick, the other physician on the board, to just give us your thoughts and your experience, if you have anything that you think that we should be considering or talking about tonight.
I know from my own personal experience this week, I've been in my pulmonary office, so our directive is that we have been asking any patients that have symptoms or recent travel that they're to call their primary care physician first, and then ultimately get the order to go to an appropriate screening facility. We have been having routine patients not come in to see us. We are moving towards certain things like telehealth and telephone visits to limit exposures within our waiting room and our visits. I think next week will be a more telling week. I am the intensive care unit rounder in the hospital. So as of right now, I know our hospital has one confirmed case, but that is I will emphasize, that's in New Hampshire. There's quite a few patients being ruled out, but we know we have one confirmed case in our hospital. We are asking for any type of supplies. So I don't know if, Brian, you can comment on this, of any masks. Are you guys accepting any donations for any masks to go to local hospitals? Because I know that is a big problem of lack of PPE for hospitals and healthcare workers.
Which is personalized protective equipment.
Yeah, I don't think anybody is offering up PPE donations at this point. I think everybody's trying to get it for themselves. We do have a limited supply here for the workers, and for the fire department, we already did the fit testing with them. So if there's donations out there and they want to give them to us, we'd be more than happy to accept it and distribute it to the community health centers and local hospitals.
Well, places that might have PPE included hardware stores. They may have the NIOSH masks, which are equivalent to the N95. different schools, so the colleges, which are not in session now, may actually have excess supplies of PPE. Veterinary offices may have excess supplies of PPE that they might consider donating. And I'm just thinking of places that, might, not have an immediate need. So,
Frank, if I can add one more thing, I will say that just as a practicing physician who was, starting my internship and residency during the H1N1 epidemic, and now dealing with this and seeing how quickly things are changing minute by minute, it is alarming. It is scary. I think that I'm not sure. I think the worst is still yet to come, and I definitely caution everybody to go to appropriate and reputable websites like the CDC, our website, call our hotline, and not focus on social media.
Very good. Let me open the floor to Michelle. Did you have anything that you wanted to add, or do you have any observations from being a mother and a citizen and somebody who's in the community every day and whose husband is also a first responder?
Well, first of all, I just wanted to thank Brian and Stephen and Caroline and yourself for all the hours and efforts you've made since this started. And I also just wanted to thank the town in general. I would say, from my perspective and being a communications expert and an emergency communications person, I've been really impressed with frequent, consistent, easy to digest information. And I think that's really important for us to continue to do. So I just wanted to thank everybody for all of their efforts and consistent, and being really, really proactive in communicating and using multiple channels to get that information out. I feel like very quickly I've been getting information from all different areas in the town as soon as they know it. And I think that makes everybody in the town feel better that, there's not hidden information. It's all coming out as quickly as it's received. It's being shared with people in the town.
Very nice.
Thanks, Michelle.
Let me move to Daphne. Daphne, your experiences in the world of, you work for a health insurer, right?
That's correct. I would like to piggyback as well on what Michelle said, because I know you guys are in the front line. So pretty much for our book of business, everything as of Monday, either we're not holding meetings or seeing anyone face to face. So that's pretty much what's happening in the healthcare world for health insurance. But I also wanted to find out, because I know for seniors that are out there, what I know Stop and Shop, it has senior hours. Brian, do you know if Market Basket is doing any early hours for the seniors? Because I know Stop and Shop is doing 6 to 7:30. Is Market Basket doing any early hours for our seniors?
I'm not sure what the hours are, if they've changed anything as of yet. I can definitely look into that and advertise it. If they have changed
I can get it while we're on the call. I just saw it a couple minutes ago. I'll find it.
Thanks.
Thank you. So pretty much we echo just lots of hand washing, and this is a time where we just need to come together, but also to listen to the professionals, because it's real, and also for the people that are in the front line, you guys, the healthcare professionals, we thank you for what you're doing, because you're risking your life as well. So just listen and do a hand washing. If you don't have to go out there, then stay indoors. That's what I can add as being in my shoes.
Very good. Joe McCarthy, not last nor least, but you're up.
Several words just used by Daphne come together. So many people in the nation have been I'm on oversaturation with political discourse. That seems to a great extent to have been coming to an end over the coronavirus, and that's really refreshing. Much, if not most, of the nation is finally pulling together the way that we should. I have a number of bullets I'd like to go over, but first a question to you, Brian. The North Andover Food Service, and again, in the state of emergency, it's offered to North Andover kids and teens, North Andover senior citizens, North Andover residents. And you can pick up the food at the Stevens Memorial Library from 11 a.m. to 1 p.m. Monday through Friday. Question. If you are a North Andover resident, if you are a North Andover senior, do you have to go online and put your order in, or just show up and pick up food? The reason that I say that is, as Daphne said, a lot of seniors are not computer literate in our town.
I think there's a phone number you can call as well to get your name onto the list. So you can use your phone.
But you have to be on a list. Can you just show up? Do you even have to be on a list?
I believe they request you call ahead so they know they have enough food for you.
Okay.
But I know
that's not quite what I see, but you're probably right. Yeah.
can I interject?
Yes,
please. I know the senior, like Paula at the senior center, they are expanding, like Brian said, the Meals on Wheels program. So they've added a lot more names to that. And then we're also, Sienna's collecting donations and they've been distributing those as well. But as far as the meals that are at the library, they are asking that people call ahead of time. So it's not so much that you have to, get on a list. I think they just take it day by day, and they just want a day's notice if how many meals they need.
So you call at least a day in advance. Is that correct?
Yes, at the business day before. So if you're looking for a meal on Monday, you're going to call Friday before noon, before town hall closes.
Yeah, that's pretty much the way it is, has been at the senior center. If you want to have lunch there, you let them know the day before as much as possible.
Okay.
And I think they've adopted that model. You can also call the senior center too to get Meals on Wheels. They've expanded their program and lessened the requirements, the age requirements for that program.
When Patrick was speaking this a few moments ago, one of the words that he used was alarming. I was going to use that word too because is the fear of the virus more dangerous than the virus itself? Perhaps, don't know, only time will tell, but there certainly is fear. I'd like to go over a number of bullets that are relevant to what we're talking about right now. Hand sanitizers, if you can't get them, and they are or have it in short supply, very easy to make. 2 parts isopropyl or rubbing alcohol and 1 part aloe vera gel, and that's your hand sanitizer. Again, I'm going to go over a number of different bullets here. No coronavirus deaths in the U.S. and South Korea for people under 30 who have had this virus. Of course, this information is dated. It's already several days old. Today's CDC update, total cases, 10,422, 256 of which are in Massachusetts. 2 of them are in North Andover. The deaths in the country, 50. And these are all jurisdictions, all 50 states, the District of Columbia, Puerto Rico, and the U.S. Virgin. World, the total cases are 230,558, and the deaths are 9,390. And these numbers are really, particularly the cases, are going to really ratchet up quickly. Why? Because people are finally being tested. So you're going to see this number, certainly in the United States, it's big time virtually every day. And I would say, don't be afraid, don't be that concerned. It's just that people have it, and many of whom and have already recovered from it. Protect yourself, and even Frank and I were talking about a day or so ago. Like, for example, yesterday I bought some gas, and I was holding the gas handle to the pump, and I took my hand off the handle when I finished, and I just sprayed it on my hands. The same thing goes when you shop. If you have a cart, be sure that the handle is clear, and be sure the handle is clean. Excuse me. 2 other things here. Recovery. How do you know if you are recovered? No fever or cough without medication. and 2 negative tests. Now, recovered. The coronavirus, it can't survive to 3 days on plastic and hard surfaces. And again, I was thinking of the gas pump handle that I held yesterday. And 1 day on cardboard. The lighter side, and I'm glad the last member of the board, at least right now, to be speaking. There is really some uplifting news. For example, China has closed down its coronavirus hospitals. That is, we've heard that they're putting hospitals together, 1,000-bed hospitals in 10 days, and there aren't enough cases. As a matter of fact, there has not been a new case of coronavirus in Wuhan, China, where it allegedly started from, in the last 24 hours. That is, if you can believe what the Chinese communists are saying, which at best is questionable. Researchers of the Erasmus Medical Center, that's in the Netherlands, claim to have found an antibody against the coronavirus. Apple reopened all 42 of their stores in China. Cleveland Clinic developed a coronavirus test that gives results in hours, not days. The number of new cases is declining in South Korea. It is quite high in Italy, and a reason that it's quite high in Italy is that there are more. The percentage of the elderly populace in Italy is higher than in any other European country. That is, scientists in Israel are likely to announce the development of a coronavirus vaccine. A network of Canadian scientists are making excellent progress in the coronavirus research, et cetera, et cetera, et cetera. I read today that there was a malaria drug. It's called Fosun. It shows promise in treating the coronavirus. Tests are underway in China right now on that. Bayer has just denoted, just given the United States government 3 million tablets of this malaria drug.
Hydroxychloroquine.
Chloroquine phosphate, that's what it is. But it's referred to as Vasoslin, if I'm pronouncing it correctly. Plasma from newly discovered patients from this coronavirus can treat others infected by the coronavirus. It's still experimental stages, but it looks really promising. And last but not least, I would say from a personal perspective, limit your time listening to TV. A lot of these people don't know what they're talking about, except for the people like the CDC. They're very, very good. But it's depressing. It really is depressing. So what I've been doing, because there's so many people, and I am senior, I've just been taking a walk and exercising and working around the house and trying not to watch that much TV, which is easier said than done. And that's it as far as the points that I want to make.
Thanks, Joe. Before we move on, I just wanted to make a few other points based on my week back at work in a healthcare facility. I think that the first issue is even among healthcare professionals who probably have more information and understanding than the lay public, there's very high levels of anxiety. And I've seen it in my own colleagues and in other specialists that I interact with. And I think it's important that we all show patience with each other because we're all experiencing this anxiety in different ways, that we show kindness towards each other and also forbearance, that, sometimes things are said that are really the anxiety speaking and not necessarily aimed at you, but it's something that, we need to think about. As far as telehealth, we're basically doing very similar to what Patrick had described, where I converted all my office appointments to telephone appointments. I do have availability for a physical visit, but it's really got to have special circumstances. The best that we know right now is most circumstances of transmission are by droplets, and droplets can go about 2 or 3 feet away. So the issues are flat surfaces that droplets can land on. Those can be a contact place where the virus can be. You can pick it up. You don't want to touch your face or touch your eyes. So you have to keep your hands off your face. This is one of the arguments against wearing the protective masks in public, because you're constantly adjusting them. And where is that mask? It's on your face, and you're moving your hand near your face. I don't think that the jury is out on whether a mask is helpful or harmful, but I think that there's some potential risk and harm as well. My hands are pretty raw. I pretty much wash my hands about every 5 or 10 minutes through the day, and lately I've been working about 12, 13-hour days. So you got to wash your hands a lot. When soap and water isn't available, use hand sanitizer, and you want to be careful about touching things. I've gotten into the habit of, once I've used a sink with water, I hold on to the paper towel and I use it to open door handles with, because those handles are also contaminated. So just some things to think about. What else?
Also, good news, about 100,000 people already have recovered from this coronavirus.
In the United States?
No, that's the world.
Yeah. So we're still early on. I think I'm going to echo Patrick's point that I think that we're not through the worst of this yet. I know that our operating rooms and procedure suites are closed for 4 weeks. I know that the schools in North Andover are closed for 3 weeks. We're not through this yet, so hand washing, social distancing, try to stay 6 feet away, and we're going to come back to that topic when we talk about some new business that I'm going to have Brian bring up in front of us. If there is there anybody else on the call who would like to make a point before we move on to new business?
Can I jump in real quick?
Absolutely.
One thing I just wanted to touch upon too, this is in one of the documents me and Brian drafted. It's just, it really is a community effort. Like, it does start at the individual level with hand washing and good personal hygiene, like covering coughs and sneezes. But make sure, you know what I mean, that you reach out to, if you have family or friends who are immunocompromised or elderly that might have difficulty getting the supplies they need, just to kind of keep an eye on them and see if you can pick something up for them if you are held able to go, like, shopping or to a pharmacy, say, that may be busy. That was just something I wanted to talk about.
Right. I think we want to caution people against visiting the elderly, though, because you may actually visit something unintended to them. So I think you want to make sure that you keep your distances. You can drop things off, but you don't want to spend a lot of time in close proximity with somebody who's more vulnerable, whether that's somebody who's got cancer and is on chemotherapy, whether they have an inflammatory condition and they're on drugs to control inflammation, or, you know, if they're just elderly or they have problems, chronic health problems like diabetes or COPD or liver disease or heart disease, people over the age of 60, that's the vulnerable group.
For sure, yeah. I think in the document we mentioned, like, trying to call them versus, like, showing up to their house.
Right.
Thanks, Steve. One thing I wanted to add, Frank. Market Basket starting tomorrow, each Tuesday and Wednesday and Thursday from 5:30 a.m. to 7 a.m. The stores will be open, only to serve customers 60 and over. So that's new, as well as the food assistance line. It's the COVID hotline here. It's in the numbers 978-208-6070. Call the day before to order a meal.
Thank you, Brian.
Sure.
And you just mentioned, Frank, a few moments ago about the elderly being more susceptible to this virus than young people. I'm very close to my youngest daughter's 3 little kids, age 4, 3, and 2. And one thing about little children, it seems like they're always sick. So they could even have the coronavirus, and kids do very well. At least it appears they do a lot better than people handling this virus. They could be sick. If I went there, I could get sick from them. And guess what? I may not do nearly as well as they're doing. So just be careful. I know, like so many other people, I'm going to miss spending time with the family, but it's needed. We do what we have.
Yeah, Joe, I'm going to bring up one thing, and Patrick, you might want to just put your own opinion on this, but, you know, we're talking about children as being generally mildly affected by the disease, but they can also transmit the disease to their adult relatives, and that's a concern. And young adults, and I'm talking younger than me, in their 30s and 40s, are also at risk for severe disease. There have been cases of ARDS, which is acute respiratory distress syndrome, which can be deadly, and also viral cardiomyopathy. And so, you know, just because you're 30 or 35 years old or 40 years old does not mean that you cannot get severe disease from this infection. Which actually brings up another point, and then I'll let Patrick chime in, is if you go to the CDC website, there is a pictograph, and what it is it's an upside down pyramid, and at the top of the pyramid is the most effective way of protecting yourself. It's called the hierarchy of protection, and at the bottom is the least effective intervention, and at the top of the pyramid, it's separating yourself from the hazard, and at the bottom of the pyramid, it's personal protective equipment. So the lesson is it's much more effective to separate yourself from the hazard than it is to wear personal protective equipment. And in the middle, it's environmental controls, things like, you know, washing surfaces, flat surfaces with anti-infective wipes, et cetera. So those are called engineering controls, but your best bet is to just separate yourself from the hazard.
Frank, I couldn't agree more with that. Going back to your original point about the patients that are dying and the younger ones, viral cardiomyopathy seems to be the biggest odd part of this disease that's coming out of China. A lot of patients are dying from cardiac arrest as opposed to acute respiratory failure, which is something that we not typically see for a disease that seems to be predominantly affecting the respiratory system. Patients are less hypoxic, meaning they don't have as low of an oxygen or higher requiring extra oxygen that you would get through a mask or some other type of breathing apparatus. And patients are improving and then all of a sudden getting much worse. And it seems that it's affecting their cardiac function. Again, these are the rarer cases. These are the ones, the patients that are dying in China, and a lot of this data is coming out of what we're learning from China.
Thank you. And just for the public who might be listening in the call, a cardiomyopathy is just a fancy way of saying heart failure. The pump just fails, and everything that depends on that pump, which is all your other vital organs, die because of that. So, good. Brian, I think this might be a good time to introduce some new emergency business.
Okay. We don't have this stuff on the agenda because it was an impromptu meeting that we kind of called at the last minute, and we got it advertised 48 hours before the meeting. One of the things we talked about was recommendations regarding businesses that have a hard time with the 6-foot social distancing rule, such as salons, nail salons, barbershops, acupuncturists, massage parlors, things like that. And we've gotten a lot of questions, and a lot of people have called out with concerns regarding the close proximity and the number of people going through some of these establishments. I think over the past few days, the numbers have gone way down, but I think some of them are still open and still servicing people on a regular basis, which is a cause for concern. So I talked to upper management in the town manager's office. I talked to our town council, and basically what we have with the state of emergency going on right now and the declaration made by the selectman and the town manager last night affords you guys the ability to make a recommendation to the town manager to close any type of business you think might be putting people in jeopardy of spreading and contracting the virus. So I figured to throw it back to you guys to discuss it, see what you think, and kind of do a round robin on this particular topic.
The floor is open to anybody who wants to start. Just identify yourself as you come on the phone.
Frank, it's Pat again. A very quick, short statement. I think you kind of led with the CDC recommendations as the first line of defense is social distancing, and I would be all in favor of supporting this, mainly for the social distancing.
Further comment, and just please again identify yourself before you speak.
Joe McCarthy, I hear what you're saying about social distancing, and as I said earlier, does this include the physical therapist? Boy, that's a tough one because people go there, and I have an appointment soon. Physical therapist in North Andover. It's important, but there was not that distance. There was not that 6 feet. There's not even 3 feet. So I don't know how that's going to be. I don't know how to get my hands around that one there.
I think in certain fields such as doctor's offices, physical therapy that's done for medical reasons, maybe I wouldn't say exempt from this, but you still have to have some sort of care and physical treatments to go on with everyday life. I think the other businesses that are for different types of scenarios and situations is what you should concentrate your efforts on, I think.
Further comment?
No.
Not hearing any further comment. We had a draft motion that has been circulated, and if somebody would like to make that motion and read it into the record, we can discuss the motion and anything that we want to do with it, whether we want to keep it as it is or change it or accept it or reject it. But I'd like somebody to read the motion into the record. And again, identify yourself.
I can read it. This is Michelle. I move that in order to protect the public health and safety of the North Andover community from the health risks created by the COVID-19 virus pandemic as declared by the World Health Organization and in recognition of the national, state, and local declarations of emergency, the Board of Health finds that a number of personal service businesses cannot be provided at a distance of at least 6 feet, and therefore recommends that under the authority vested in the town manager, the declaration of emergency, he orders all nail salons, hair salons, barbershops, massage service, body art, tattoo services, and acupuncturists close on March 20th, 2020 for the duration of the North Andover Declaration of Emergency.
I'd like to ask for a second so that we can discuss it, and if you second, please identify yourself.
Joe McCarthy, I second.
Okay. Is there discussion on the motion? Maybe I'll start, and I'll say that this is a request of the Board of the Health for the town manager to do something. The town manager is actually going to be the person who makes the order under her emergency powers. So this is the Board of Health making an official recommendation, but it's not a Board of Health order. But it will be operationalized by the town manager. And people are welcome to discuss any or all components, or if there's no discussion, then we can move to a vote.
This is Michelle. I'm assuming in the writing of this, we covered every service organization we feel we need to.
At this time, yes.
Okay.
It appears that every service under this motion is a service that comes under the Board of Health's auspices. So this is all within our wheelhouse.
Okay, thank you.
So if there is no further discussion, what I'm going to do is I'll just take a roll call vote, and it'll be aye or no. Joe McCarthy,
Aye.
Patrick Scanlon,
Aye.
Michelle Davis,
Aye.
and Daphne Alva LaFleur.
Aye.
And I will vote aye. It's a unanimous vote. So the motion carries and it's adopted, and we will make our official request to the town manager. Brian, is there other new business that we were going to discuss?
I think one thing that we had on our list, just from talking back and forth the other day, was playgrounds. Since we've actually talked, the town manager did make a recommendation and advised people that the playgrounds can't be cleaned and sanitized. Other departments took that to the next step and posted that the playgrounds are closed. I'd like to get just your opinion on whether you think that is appropriate and to keep up with the closure of the playgrounds until the emergency declaration is actually lifted. So McAvoy and Drummond have been locked and signs have been posted. It's the other playgrounds that are concerned because there's no physical structure surrounding them and people can have access to them 24/7 basically. So I think making a recommendation to the town manager to close them could be, like officially close them, could be something that we discuss and move forward with. If it's
Joe McCarthy, I support that, and this is the reason why, as I said earlier, this virus can survive up to 3 days on plastic and hard surfaces, and 1 day on cardboard. There's a lot of plastic and a lot of hard surfaces in our playgrounds, and therefore I think it's wise to shut them down.
Thank you, Joe. Frank here, Frank McMillan. My own opinion is that this is also a place where, unfortunately, since school has been canceled, it's also a place where people are congregating, which is exactly the thing that we don't want to do. Now, you could make an argument that they're congregating outside, but I think it comes down to the equipment that the children will be very tempted to climb on and play on, and the information that we're getting is that it's not possible to sanitize the equipment adequately to protect from, contact. Again, this is a droplet disease, contact spread of the disease. So even though you might not be sneezing or coughing on somebody because it's outside, you're touching the equipment, you're sneezing into your hands or coughing into your hands, you're touching the equipment, somebody comes by and a half hour later and they've picked up the virus because they touched their face or touched their eyes, which is very hard to get children not to do.
This is Michelle. I fully support closing the playgrounds. I think they are town property and therefore recommended that the town takes, including us, take any opportunities we can to try to reduce risk for our citizens. And to me, this is a way of doing that.
Michelle, that sounded like a motion to me to request that the town manager close the playgrounds. Did I hear you correctly?
Yes, you did.
Okay. Is there a second so that we can further discuss?
It's Pat. I'll second.
Okay, so it's been moved and seconded. The floor is open for further discussion. Who would like to discuss further? Or if there's no discussion, we'll move to a vote.
I think we should move to a vote, being that I'm a mom as well, and to me, I agree with all of you guys, and to keep everyone safe, and as we talk to kids, they carry germs, and I think it's best to keep everyone safe and make it official with the town to close the playground.
So we've heard argument in favor. Is there anybody against? Hearing no further discussion, we'll move to a vote on the motion on the floor, which is to request that the town manager use her emergency powers to close the playgrounds at the request of the Board of Health. All in favor, say aye.
Aye.
All
Aye.
opposed, say no. Without a roll call, we'll take that as a unanimous vote, with the chair also voting in the affirmative. Brian, other items for discussion?
the last one for discussion is an election discussion. We have the town election scheduled for March 31st. You and I were both on a meeting last night with the selectmen via conference call, and it was discussed and it went back and forth as to whether to postpone the election. We were charged with thinking about doing it safely. How do you get people to come in and vote? How do you protect the workers? How do you protect the residents? And tossing around different ideas as to how to get that done. I'd like to put it to the board to discuss and form an opinion, to give a recommendation to the town manager as soon as we can. So whatever you guys want to discuss, whatever aspects you want to look into, we can formulate a letter and give that to the town manager as a Board of Health opinion. So I'd like to open it to you guys to toss it back and forth.
So this is Frank McMillan, and I'm going to speak first just because I happen to be on the same call. The Board of Selectmen met last night by conference call. Brian and I were invited to provide information to the board, and then the board had their discussion just much like the way that we would have our discussion. We are not members of the board, so they had specific things that they asked of us, and so it wasn't really our place. It's their board and it's their discussion, but this is now our chance to talk. And so I thought what I'd like to say that it was a very, very thoughtful discussion, and I'll quickly try to summarize the points that were made. There is some interest in figuring out how to hold an election safely. And some of the things discussed were to encourage the use of absentee ballots. And that could be part of a solution, but we do not yet have a process to do a remote vote that would exclude somebody who either has no willingness to vote remotely or no ability to vote remotely. So the question is how can you provide a way for people to show up and yet still protect the town employees and also the citizens from each other by respecting the 6-foot distance. And so that's the matter before us to discuss, and so I'll open it up.
Frank, this is Joe again. What type of guidance are we getting from the state?
I don't know that we're getting any guidance as far as this is for us to decide based on the principles that we've already put out there: social distancing, 6-foot separation, avoidance of contacting the same things by multiple people, protecting vulnerable populations, which also tend to vote. So you don't want to do something that makes it difficult for certain classes of people to vote, such as the elderly or people who might have infirmities but be certainly capable of exercising their political rights as citizens of this town.
Well, once again, if someone votes in person and not remotely, because I'm not set up right now for remote voting, and of course the absentee ballot, some people just want to show up to vote. And as I said before, when you fill in the ballot, you're going to be filling in that ballot on a hard surface, and it may be dozens of people, if not more, that use that same hard surface. If one of those people has the coronavirus, it could go to that hard surface, survive again for up to 3 days. So here it is. Yeah, we close down our schools. We close down many of the business in town. We're saying keep 6 feet or more apart. We know that if you have the coronavirus and you cough, it can be extremely contagious. Yet we're talking about still being able to vote. It's not that comfortable with that. It's like, yeah, we're doing a lot, but could we be doing more? We're doing too much right now. It's so many questions.
Okay, I'm going to let somebody else talk. Who is next?
It's Pat. I have a question. Is there any talk about postponing the election?
That is on the table, as well as talking about numerous ways to try to protect employees and the residents, such as using the electrostatic guns in between each use, or sections of voting booths being used once, then sterilized, and going back and forth between different sections of booths. Individual pens being used, so nobody reuses a pen. So basically, it's you get to keep your pen when you vote. PPE for the employees and the poll workers. Right now, all the poll workers are elderly and will probably not be working the poll, so it will be put onto town employees. And we have masks, we have the gloves, we have goggles, we have PPE that will protect them to a point. But aside from that, there's always a risk. There's always a chance, there's always a risk for the employees as well as the residents coming in to vote, being in close proximity of each other. So 6-foot separation in line, things like that have all been tossed around and discussed, trying to find out the best way, but there is no 100% guarantee for any way that we've discussed so far.
And Brian, can I mention something?
Yes,
Please.
With the PPE, with the masks, in order for them to work effectively, people need to be fit tested for them. And our supply is less than a box for our N95. So I just don't know, if you're testing a bunch of new people, if there even is going to be enough of the PPE to protect people effectively, to be honest.
Correct, yeah.
In regards to the masks. You could do surgical masks, but I don't know if that is going to fly with a lot of people.
No, and Frank just talked about the effectiveness of surgical masks and the problems of them moving around and always touching them with your hands. So, thanks, Caroline.
Can I make my third motion of the night?
Yeah, but before you make your third motion of the night, let's hear if there's anybody else who wants to talk.
I agree with Joe. If we are closing down businesses and so forth and schools, I think for the protection of everyone in town, we should postpone this to further notice. I don't think it's worth the risk of, getting the frontline people sick and also seniors that are coming out to vote to expose them to the virus.
So I'll bring this, put this up for discussion because one of the points made last night by Selectman DeCollegiero was, if we postpone it, when do we postpone it to? And there's a state deadline that it has to be done by June 30th, and are we still going to be in the same situation, or can we hold? But it really comes down to, that there's a desire to want to get the voters to speak and to elect their representatives, and then the representatives can do their business representing the voters. So it's just kind of like, I'm not sure that we need to get involved in the political part of it, and I hesitate to get us involved in it, but I think if we restrict ourselves to matters of health where we do have some expertise, I think perhaps we could give them some guidance as to what to do. And what I'm hearing so far is that whatever they decide to do, they have to be able to create a separation between the public and the poll worker, and that it has to meet the requirements of the distance, the
Cleaning of the booth.
yeah, cleaning of the booth and whatnot. So at the risk of getting myself into a storm here, one of the things that I heard on my way home tonight that actually intrigued me was the topic of drive-in voting, which is actually how we test people in the community at the hospitals. They drive in, the person basically is wearing protective equipment, but the voter is actually behind the glass of their automobile, and when they're waiting in the queue, they're waiting in their automobile, and they're not exposing other people, and they're actually not going into a voting booth, but they're actually voting in their car, and they could be given a single-use pen to mark their ballot. You could check them in exactly the same way, check them out. We have that high school parking lot, which is absolutely enormous, and you could separate it by precincts and have I forget how many precincts we have, 5 or 6, and do it that way. But that's a decision for the select board to operationalize, but perhaps they could consult a process engineer to help them figure out how to do it. Practically, though, the question is can they do that by the March 30th election day? And that's not our question. That's their problem to solve. But I think that trying to be constructive, they may consider a short postponement to put a plan into place. Again, I hesitate to get involved on the political side, but if they can't meet the requirements of the separation and the non-contact of the same surfaces, then I think we have a problem holding our elections in the manner that we've always done them. Further discussion?
Frank, it's Pat. One other suggestion I have would be possibly modeling something the way the grocery stores are doing it, of having certain times throughout the day, that day being only for citizens 65 and over can only come in during that time to vote, and then the rest of the time can be open to the rest of the community with all protections in place.
See, I think that's a great idea for a grocery store, but I think it's a bad idea for voting, because if somebody shows up, they should be able to vote. If you have polling hours and the polling hours are from 7 to 7, they should be able to mark their ballot.
Well, it can be a recommendation, a strong recommendation, not a requirement.
Well, I don't even know that we need to make a recommendation for how they do it. That decision is theirs. But it was just intriguing. I heard it on the way home tonight, and it actually seemed to make a lot of sense. The other thing that it seemed to also do is create an opportunity to experiment in case we're talking about, a primary election in the future, or even the national election in November. God help us if this is still going on then. But, it's something that we may want to have them think about. But I don't know that needs to make it into our recommendation, but it's just a matter of discussion that'll be part of the public record.
Well, the vote date is 11 days from now, and the probability of things getting better in the next 11 days are very remote. There's a high probability that things will get a lot worse in the next 11 days. Moving forward by another 3 months to June the 30th, things may be a lot better at that time. We don't know. We know that things are bad now. We don't know how they're going to be 3+ months from now, and therefore it may be wise to wait a while other than voting when things are bad.
So if we're going to craft a motion, I think it's got to say certain things in it. Brian, let me have you just kind of tick off the requirements that whatever recommendation we would have. So it would be a 6-foot distance.
Yep. 6-foot distance, and then there's the whole PPE aspect of it for employees, as well as the cleaning and sterilizing of the voting polls after each use, and just maintaining the separation and the sanitization in between everybody. I think that's the most essential part. But even, like I said, even doing that, there's no 100% guarantee that something's not going to slip by, or people aren't going to transmit anything back and forth.
Right. And how would you recommend managing a queue in that setting?
It's either tape on the sidewalk every 6 feet, and the line goes around the block, and everybody moves up 6 feet at a time to the next line when that person goes inside.
Here's another problem. We know that we know that the seniors are very much involved in the voting, and for many of them, this is an important source of additional income. So, what are we going to say to them? No, you can't do it. Are we going to discriminate against them? Or we'll say, nah, you can do that, but you're going to have to wear special PPE as other people that are working there, knowing full well that they're the ones that are still the most susceptible to this virus. So
I believe a good chunk of the poll workers have already dropped out and aren't going to volunteer because of the situation and the fear of contracting the disease. So the town manager has basically talked about she wouldn't let the elderly volunteer for this because of the heightened risk and them being a highly susceptible population. So she would require department heads to get fitted for an N95 mask and probably work the polls.
And I'm sure that some of the elderly are going to feel that they're being discriminated against.
If I could interject on one health aspect of things, is this really the best use of PPE that could really otherwise be given to our police and fire department that are taking care of these patients every day, that if we just postpone the election, we can divert that PPE to other resources that are more needed?
That's a very great point.
That's a real good question, especially considering that Callan just said that we don't even have a box of these respirators right now.
Yes, we have a very limited supply. So it would be best used with somebody on the front lines exposing themselves to sick patients on a daily basis.
Frank, what do you think are, and the rest of the board, I guess, what do you think our recommendation parameters can be? Should we say that it needs to be the things Brian listed with absolute certainty, or could we say because of what we just talked about, we don't recommend it? Like where are we trying to kind of land this?
I don't know that we want to presuppose their ability to come up with a solution, because that's not our job. But I think what we should do is we should say, if you want to try to meet the deadline, this is what you need to do. If you want to do something other than that, then, you may have other options without postponing the election indefinitely. I think the biggest objection that I heard at the selectmen meeting was postponing the election indefinitely. And I think that the argument was at least from I thought it was a well-taken argument, but at the same time, it's not our responsibility to judge the appropriateness of the political argument. It's to basically make sure that however they decide to operationalize it at whatever time, in whatever time restrictions they have within the 11 days of the election, that they meet certain minimum requirements.
Well, I think that's just part of it. I think that they're looking for a recommendation also from the board if it is safe to have this vote 11 days from now.
Well, I think having this vote in the traditional way that it's always been done, I think most of us would agree that that's not something that we would endorse. Am I wrong?
You're correct, and I think we should actually state that. I think you're right about not knowing or not telling them how to do it, but a recommendation at this time could be, from the discussion I'm hearing, could be that this can't be done safely at this point in time. I think in seeing, and even Joe mentioned the China outbreak earlier, and that they haven't had any new cases in the last 24 hours. So it's been going on there for over 3 months.
Yeah, but I also clarified that by saying, do you believe the Chinese communists?
Exactly. We don't know if that's really true.
Correct.
Exactly. That's what they want us to believe. Is it true or not? I don't know, but I do know they want us to believe it.
But is that an indication that in 3.5 months we could be at the other end of this and on the downslope, versus right now we are just getting to the upslope?
Well, Brian, let's take that point one step further. So let's say we're on the downslope. Do we really want to jeopardize our gain and then expose everybody again and lose the benefit of the unbelievable pain of separation that we've done by self-quarantining?
Yeah.
I actually like the drive-by idea, just because what it does is it allows us to contain and separate the poll workers from the voter. with very minimal protective equipment. But again, I don't, can they actually operationalize that? And they should still have to make some kind of accommodation to people who walk up. I mean, again, there's a lot of stuff to think about. And again, we're not going to solve the problem for them. But, you know, I think it's up to them whether they think they can meet the deadline. But if they can't meet those minimum conditions that we identify, that I think that our request for them is to, if they can meet them, that's great. And if they can't, then they need to come up with something else.
Right. Okay.
And things are happening so fast across the country right now with these new serums and drugs and medicines and so forth that they're coming out with. Let's suppose, for example, that this malaria drug, Vasargin, I believe it's pronounced, and again, it's under test right now in China. Bayer has donated 3 million tablets to the U.S. government. Let's suppose it works, or a similar drug works. And that could happen within a relatively short period of time, months, maybe even weeks, I don't know. And as such, things could be in much better shape by June the 30th. So and we don't even know how things are going to be June 30th.
So, Joe, if you mean like, does the drug work? Does it reduce the death rate by 50%? That I would say that means it works. Does it work well? That's a different question.
Well, it's better than nothing, Frank, and that's unfortunately what we have right now. Other than things we can do, but.
So I'm saying that if we don't have perfect conditions, and we never have perfect conditions, but I think we need something better than what we have right now. So I guess the issue is that the current way of voting appears to be not supportive of the public health goal of containment. That seems to be the clearest way of saying it. And then it's up to the select board to decide what they want to do as far as trying to operationalize something that respects the public health principles that we've described.
So following that train of thought, then what we're saying is that if they take additional measures to protect people that are voting and protect people that are working there, then they have the support of the Department of Health to have the voting as scheduled on the 30th of this month. And I don't know how I have mixed emotions about that, Frank. I don't know if I can support that.
Well, this is why we're having a discussion, because I want to hear everybody's thoughts on it. Maybe it'd be helpful if I had Brian talk next. And Brian, tell me where I'm wrong.
You know what? I think right now we're looking for a recommendation to give to the town manager regarding the election in 11 days, or 11 or 12 days. I think, from what I've been hearing, the current way we do it doesn't lend itself to protect the workers or the residents coming in to vote at this time. I think that's the basics, and that's the basic thing that we have to basically portray to the town manager, that as medical professionals and as a health department and the Board of Health, it can't be done. There's no guarantee to keep everybody safe, and at this time, with restaurants being closed, bars being closed, playgrounds shut down, schools shut down, town halls closed, it goes against everything that we're doing right now to bring people together at a voting location.
Brian, it's Pat. If I can also just add about the usage of the town's PPE equipment, that I think the board should also make the recommendation that we do not feel that that's the best utilization of limited supply at this point. I mean, who knows what will happen in a month if more personal protective equipment will be made available, but I think right now I do not believe it's a good usage of PPE.
And I would agree with you on that completely, because we do have a very limited supply.
So so it sounds like we've had a good discussion here. So I think the board needs to make a recommendation. We should, craft it as a motion and make a vote.
This is Daphne. I think the motion would be, me personally, for them to hold off until at least the April 6th, like, to kind of revisit it in April 6th, to postpone it until at least then. That's what I'm proposing. I don't agree with them having it in 2 weeks.
Okay. So there's a motion on the floor that recommends that the election be postponed to a time certain. And do we want to add anything else into that motion? Do you want to condition it until such a time that, or do you want to condition it in any kind of way?
I think just the condition that there is adequate PPE available, that is, if not of limited supply. I'm not sure how to best word that.
So that there's perhaps maybe there's Tony, can you just like get down the essential pieces of this? So postpone it to a time certain. There's been a date thrown in there, and we can kind of leave that as a blank. The second part would be conditioned to adequate protection, whether that be PPE or separation. Is that acceptable to everybody?
I think it should be PPE and separation, not all separation, and as well as cleaning of the boots between use.
So PPE separation and adequate sanitation if needed.
Okay.
What else? What else needs to be in it?
And you're going to leave it open as far as the date, which I think is wise. Am I correct, Frank?
Yes, so propose it to postpone to a time certain to be determined by the Board of Selectmen.
Okay.
Based on underlying public health principles.
Okay.
All right. What other elements do we need?
I think you hit upon most of them.
Should we recommend that the town look into a process engineer to decide to help them decide on how to best effectuate the? I mean, I don't want to spend the town's money, but at the same time, if the expertise is not on the select board or in the town itself, maybe we do have somebody who has expertise. Maybe they could consult the Jeff Coco or others on how to do this best. I don't know that needs to be in the resolution, but.
So process engineer or the emergency management director?
In consultation with the emergency management director.
Okay.
Who does have the expertise, or at least the ability to access the expertise if he determines that that's needed.
Yep. Okay.
All right. So, Tony, can you just read back to us what we have so far?
Yes, postpone town voting till a time certain determined by selectmen, determining with adequate separation and PPE.
And the last piece, and a process determined in consultation with the emergency management director.
Okay.
All right. So let's start over again. So it's going to say something to the effect that the Board of Selectmen recommends to the that the Board of Health recommends to the Board of Selectmen that the election be postponed to a time certain to be determined by the Board of Selectmen. What's the next line?
Certain adequate, determining with certain adequate separation and PPE, and a process determined by the emergency director.
I don't know determined by the emergency director, but in consultation with.
Yeah.
Okay.
And also, I think we missed the word sanitation in there in the second clause.
Okay.
Can we try it one more time? And I'm sorry to be torturing you on this.
No,
And
it's,
adequate PPE available.
Let's just start it from the beginning. And I'm sorry to put you on the spot, Tony.
okay. I have as follows. The Board of Health recommends postponing the town voting till a time certain determined by the Board of Selectmen, allowing for adequate separation, PPE, and sanitization. A process,
Determining consultation.
the process consulting by the emergency director.
So the process,
Consultation.
the specific process determined in consultation with the emergency management director.
Okay.
Okay. Which one am I, sorry,
Frank, should we not add a sentence at the beginning, which would go as such, due to coronavirus health and safety concerns, and then it would continue as such, or just not even mention that at all?
well, you can put in a whereas statement saying, whereas the coronavirus, whereas the current situation with the coronavirus endemic has created a emergency situation in the state. You could add a whereas. I don't think it's really material. I think it'll come through in the minutes, but you could do that. But I think that it's really the meat of the recommendation is that these are the conditions that the Board of Health feels are necessary that the Select Board should put into place before holding an election, and we're recommending that they postpone it until they can meet all the directives. Now, it may be that the postponement is April 7th, like Daphne suggested, but I don't think it's within the purview of this board to tell the Select Board on how to do its job. Just we're giving an advisory opinion that in order to protect the health of the residents and to protect the health of the workers, and also to minimize the the excessive use of PPE in order to steward the appropriate. I think the meaning is kind of self-contained.
Okay.
Brian, any
That
thoughts?
sounds great, Frank.
Do you like it?
I think you guys nailed it. That pretty much states what your opinion is and your reasoning behind it.
All right. Any member wish to make that motion, and we can have Tony read it so you don't have to remember it.
Oh, God.
Which member? Michelle, you want to go for 3?
I'll let somebody else take it.
I'll take it.
Tony,
It's all
you want
yours.
to make the motion?
You got it, Tony. You got it.
Okay, tell me when you want me to read it.
Okay, so who's making the motion? It's just like F Troop. Everybody's take a step back, right?
I'll make the motion.
All right, so Mr. McCarthy's making the motion, and we're going to have Tony read it into the record.
Okay, so the Board of Health recommends to postpone the town voting till a time certain determined by the Board of Selectmen with adequate separation, sanitization, and PPE. The process will be consulted by the Emergency Management Director.
The process will be made in consultation with.
The process will be made
In consultation with the Emergency Management Director.
Tony, would we not want to put, Frank, would we not want to put March 31st there? You know, other than saying town voting.
No, the town election is already scheduled for March 31st, so we don't have to put it in our recommendation. They already know when it is. It's just that we feel that if it is necessary for them to meet the conditions that we're stating are necessary to protect the public health, that we feel that they need to postpone it for any number of days or weeks, however they see fit. If they can meet the conditions, then they can have their election.
Can I also say, instead of maybe saying PPE, just say personal protective equipment, just so everyone is clear?
Yeah, you know what? We will make, Brian and I will make editorial changes, but
Okay, perfect.
as needed. And editorial changes will be very simple, 1 or 2 word, just to correct the grammar and make it sound right. But I think that the ideas and the elements that are contained with it, I think we need to vote on as a group.
Well, we need a second.
I'll second.
Thank you, Mr. McCarthy. Is there a second?
It's
I'll second.
Or either of us are fine.
Okay, I think I heard Patrick first, so Patrick will be the second. Is there further discussion? Hearing none. Are we ready for a vote? Hearing no objection, we will take the vote. I'm going to take it by a voice vote. If it's not unanimous, we will take a roll call. All in favor say aye.
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 Aye. All opposed say no. The ayes have it. It is unanimous. We will make the recommendation to the Board of Selectmen. Brian, is there further business for discussion?
That is all that I have on our, lack of agenda for tonight.
All right. Is there a motion to adjourn the meeting?
I make a motion to adjourn.
Is there a second?
Can I ask a question first?
Yes, there's a question.
Is this meeting a emergency meeting, and are we still having our formally published meeting this month, or no?
This is an emergency meeting, and we still have a scheduled meeting.
Okay, thank you.
The scheduled meeting will also be done by conference call.
Okay. Sorry.
All right. So I heard a motion to adjourn the meeting. Is there a second? I heard a second. I think that was Mr. McCarthy seconding. All in favor of adjourning, say aye.
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 Aye. Any opposed, say no. The meeting is adjourned. Thank you all for your time, and thank you for an excellent discussion.
Good night, everyone.
Thanks, Frank.
Good night, thank
Good night, everyone. Thank you.
Good night, guys.
Thank you.